Hello and welcome once again. For those of you who have been with us all day, thank you so much for hanging in there all day. Uh, for those just joining us for the 2 presentation, I'm really glad you are here. Thank you so much. And I'm excited for this too. Today, we've got Katie, and Katie is the clinical sales manager for phlebology and lymphology at 2. She brings nearly 20 years of experience as a registered vascular technologist and with a career dedicated to the management of patients with vascular, venous, and lymphatic disease across hospital systems, private clinics, and corporate healthcare settings. Katie has completed the close lymphedema therapy certification, is a member of the American Vein and Lymphatic Society, the AVLS, for those of you who haven't heard that one before, and is deeply passionate about advancing education and awareness in the vascular disease and lymphedema management space. So I'm excited about this. I know that we've been doing a lot of work with Tuan over the last couple of years, and it's getting more and more. And I really appreciate it. We're starting to see more and more coming in, and I think it's a lot of fun. I think you all are going to learn a lot. There's a couple little housekeeping items I want to mention in the chat. We have a Teams lounge. It has been going on all day. It has been staffed with my different members of my team from Compression Care. The link is in there. You can go over there. It's just a Teams meeting. There is no formal presentation going on. It's a place for you to go, hang out, chat with the team. You can ask additional questions that you have. You can ask process questions about our process, and more questions about the products themselves. Everybody in there is very knowledgeable about the products. We order them all the time. Uh, or you can just tell us a joke. We'd love to hear that. So that link is there. And then there's another link there that is the compressioncare.com/big day of training resources. That is where you're going to go to find all the cool cheat sheets that Katie has prepared and to get your certificate for participating in this class and being a part of this. So we really appreciate that. Don't worry if something happens and you can't get to the link and you can't get to that resources page, you're going to get emails. You're going to get emails from us over the next couple days. I can promise you it will not be today, but you will get emails from us that will allow you to find all the resources you need to download these forms. And if you have any other questions, I'm going to put my email address on the screen here shortly, and you can definitely see that. So I'm going to be quiet though. I'm going to try my hardest to be quiet. For those of you who know me, it's difficult, but I will try to be quiet. Post your comments, your questions in the chat. I'll make sure that I help Katie and field those with her. And anything you need though, drop it in that chat. We'll get to it. Without anything further from me, Katie, please take it away.
Thanks, Josh, and thank you everyone for joining today. This is, I think, a great session that Josh has prepared for all of you today, and I hope that you are going away with some sort of knowledge that you didn't know coming into this. So, um, I am going to talk to you about protecting reduction and the importance of nighttime compression and lymphedema maintenance and how and why Mobiderm AutoFit improves the maintenance and adherence. So, you all already know how compression works. And what we're really talking about is why our best reductions don't always hold at home and why that failure almost always happens overnight. Today, we'll frame the clinical problem, connect connected to the maintenance failure and adherence, and discuss a practical, reproducible approach that supports the work you already do. So, for those of you who don't know who Tuan is, Tuan is a French company that was established in 1847. And yes, it's pronounced two, like the number two, then Anne, or if you are from Europe, it's Tuan. It's six generations of entrepreneurs and is women owned still. Its global headquarters is in France. And Tuan manufactures products for lymphedema management, venous disease, post breast surgery effects, musculoskeletal disorders, and spinal conditions. So under the Tuana umbrella, it includes brands like TheraFirm, which are compression products that are manufactured in Hamlet, North Carolina, KnitRight, which are OMP textiles and other medical textile interfaces that are manufactured in Kansas City, Kansas. And then the Mobiderm products and brand products are manufactured in France. So today we're going to cover why night compression matters clinically. We'll go into evidence supporting the night garments, Mobiderm technology and the mechanism of the action, why AutoFit improves adherence versus bandaging, and how to implement this into your practice. So first, let's start off with why night compression matters clinically. During the day, patients benefit from the muscle pump and upright positioning. At night, patients excuse me. Sorry about that. At nights, patients are inactive, and this increases the risk of fluid reaccumulation. Nighttime compression helps maintain that daytime volume reduction and prevents morning swelling that slows progress. So, clinical challenges and maintenance failure. After the intensive phase, volume rebound is common, not because treatment failed, but because what we do in clinic is hard to sustain at home, especially overnight. Maintenance failure is the loss of volume reduction achieved with MLD and bandage. Sorry, products, guys.
So looks like we're having a slight technical difficulty. I apologize, but we'll get there. No big deal.
Sorry,
Seriously,
guys.
we'll get there.
So maintenance failure is the loss of volume reduction achieved with MLD and bandaging. And it most often occurs between sessions, especially during rest. Without night compression, fluid reaccumulates. Adherence in night bandaging is limited by discomfort and complexity, and compression is often inconsistent. Over time, this contributes to fibrosis. Clinically, the consequences are real: morning swelling, poor garment fit, patient frustration, on top of therapist frustration, right? Slower long term progress and increased risk of skin changes or infection. So, night compression garments such as Moviderm AutoFit help protect reductions overnight by supporting consistent, feasible adherence. And the goal is simple: protect the gains that are already achieved. We want to protect all that work that you've done, all those patients, all the patient time that they've spent with you in your clinic during the day. You've worked hard to get that patient reduced, and we want to be able to maintain that reduction. So why limb volume increases overnight? Overnight, lymphatic flow slows. We lose the muscle pump from walking and limb movement, which normally helps move fluid. In the horizontal position, drainage dynamics change, and without active movement, efficiency drops. On top of that, metabolic activity decreases at night, so fluid clearance mechanisms work more slowly. Evidence supporting night garments. The literature doesn't say night garments are magic. What it does show is better volume stability and symptom control compared to no night therapy at all. Importantly, patients consistently report improved comfort and better sleep compared to night bandaging, and that matters because adherence drives outcomes. We know that the more consistent patients are with wearing the garments, the better outcomes they're going to have in long term results.
Just
So,
so if you don't mind,
randomized,
oh, sorry. I was just going to interrupt you for just one second. I
oh,
apologize, but
you're fine.
one of the things too that I just wanted to point out in all of this that I think is important to note is like, from all the evidence from everything that's gone out, you know, when Medicare started releasing the LTA, when they were doing all of that research, they laid out a standard of care, and that standard of care includes nighttime garments. And I mean, that's basically like saying, hey, the best way to treat this pain is whatever, or the best way to treat this heart condition is lisinopril or whatever they're going to say, right? They come out with these recommendations, these standards of care, and they came out with a standard of care. And that standard of care says nighttime garments, they're important, right? And so, sorry, I didn't mean to interrupt you. I was just thinking about it from a medical standard perspective.
No,
It's on the list.
absolutely.
These are things that need to be happen. This needs to happen. So anyway,
Thanks. That's and I couldn't agree more. So, and of course, there's evidence for nighttime compression. There's several randomized trials that show night compression improves 24-hour volume stability. It reduces overnight swelling and improves the symptom burden. So, in the real world practice, many patients remove their compression garments at bedtime, sometimes due to the discomfort, heat, or simply out of habit. Nighttime bandaging can also be complicated and time consuming, which also leads to inconsistent uses and reduces adherence. So, as a result, we often see a measurable increase in limb volume by morning, and that swelling can compromise the fit of their daytime garments, making them less effective and uncomfortable. And over time, the patients will just stop wearing their garments because they're not going to fit. And then this cycle, of course, it reduces overall effectiveness of the treatment. And then we're starting over again.
for sure.
So, compliance is a clinical outcome. Poor compliance often leads to maintenance failure and gradual progression of lymphedema. And in the maintenance phase, it's important to remember that compliance is the treatment. The effectiveness depends on consistency of the use. If it's not doable, it's not sustainable. These patients, they want easy solutions that they're able to manage on their own. So, what is Mobiderm technology? Mobiderm technology uses differential pressure via foam blocks to create micro massage effect, mobilizing edema. It addresses tissue changes, not just containment, which leads to softening fibrotic tissue even at rest. Think of Mobiderm as a less traditional compression and more as a tissue mobilization under compression. The foam blocks create differential pressure and microchannels that gently mobilize superficial edema and help soften fibrotic tissue, even at rest. So, this Mobiderm technology is integrated into all of our garments. The Mobiderm AutoFit, it provides an adjustable, reproducible option for patients so they can maintain that reduction at home. Um, and they can apply it independently, even without a caregiver, versus where if someone needs to be bandaged, bandaging is very complex. If someone has dexterity issues, they're not able to bandage on their own. So, Mobiderm AutoFit helps these patients have autonomy in managing their lymphedema volumes at home. Oh, sorry, I didn't advance that slide. Here's the slide that I was just talking about. And my computer is giving me issues today, guys. I'm sorry about that. So Mobiderm is clinically proven. We have several clinical studies across several different countries involving different patient profiles, but this one in particular, it involved 40 women with upper extremity breast cancer related lymphedema, stages 2 to 3. And what they did is they tested these patients over 90 days during the maintenance phase. And the study concluded that the use of Mobiderm AutoFit nightly had less volume increase after MLD or intensive therapy compared to those who didn't use it at all. And even patients who didn't start wearing the AutoFit from the beginning, but once they did, their limb volume did stabilize and remain stable over the next 3 months. Here's a patient experience with a Mobiderm AutoFit showing a before, during, and after picture of her. The patient quotes that Mobiderm AutoFit became part of my routine. It never felt bulky or restrictive. It simply just worked. The patient also said that at first I was skeptical. How different could it really be? But the moment I tried it on, I felt something I hadn't felt in a long time, which was relief. The material was lightweight and breathable, a small miracle compared to what I've been using. I remember thinking, this can't possibly work. It's too comfortable. But I gave it a try that night, and to my surprise, I slept soundly. No waking up in the middle of the night drenched in sweat, no constant repositioning, no Velcro digging into my skin, just comfort and gentle support. And surprising bonus of the light massaging effect with a very small movement. From that night on, Mobiderm AutoFit became part of my routine. I even started wearing it during the day when I was doing light activity. It never felt bulky or restrictive. And here's another patient experience with Mobiderm AutoFit, and this is me. I have lymphedema. I had it since I think 2008 was that I was initially diagnosed, and I get flare-ups, and I wear compression usually during the day. I never had nighttime garments until I started working for Tuan, because the therapist that I went to, I think in Michigan, I guess I was in lymphedema therapy a long time ago, though, too. We didn't have nighttime garments, so they didn't feel the need for me to have them. So I really didn't learn about them until I started working for Tuan. So I've always managed it with compression during the day. Um, I would always have flare ups, especially when I would go on vacation and I wouldn't be able to even get shoes on my feet because I would swell so bad. I've had a few bad flare ups over the past few years, and one of them was because I did have foot surgery. And again, I had foot surgery 8 weeks ago and having another flare up again. So the AutoFit is my best friend, especially right now because of the type of foot surgery that I've had. I cannot wear any compression. So I'm using the auto fit at night to manage. Um, and as soon as I got the green light to wear the auto fit and get out of my walking boot, my surgeon did allow me to wear it. Um, you can see after night one in this photo, I had some great reduction already. You could start seeing, the architecture around my ankles and my foot. And then after 3 nights, I was actually able to get a normal shoe on during the day. And that was my biggest concern was I needed to start traveling again for work. What am I going to do for footwear? And after 3 nights, I was able to put on a normal shoe and not just a Birkenstock. So it helps people like me. And I'm sure that you have lots of patients out there who are in similar situations who just need something that works for them so they can be compliant and they can maintain their reduction or have continued reduction. So, which conditions benefit from the Mobiderm AutoFit? Um, Obviously, lymphedema patients, primary, secondary lymphedema, chronic lymphedema, post traumatic lymphedema, post surgical lymphedema, fibrotic or indurated tissues, patients with overnight rebound, fibrosis, bandaging burnout, or declining adherence are ideal candidates for nighttime compression solutions. Even, wearing this product during the day, when you have someone who they're not going to be compliant with bandaging and they need some sort of solution, Mobiderm AutoFit is easy enough for a patient to wear during the day. I wear mine around my house, and I know the other patients do too. If they do need extra compression over top, you could apply a short stretch bandage over top, or you could use a compression sleeve or something like Compresso Grip, which is a TheraFirm product similar to a Tubi grip. You could give them cut off a piece of the compresso grip where they could slide over the top and have the extra compression during the day. But it's a great solution. It's easy to use. It's easy to adjust. It does really conform to the patient's body shape. Um, it will be a little stiff at first, but once the patient starts wearing it, it does loosen up over time. The Velcro stays closed at night. It does not come undone. It does not snag. It doesn't twist around. The Mobiderm, the Auto Fit, it comes in a full leg option, a below the knee option, and an upper extremity option. For the lower extremity, it has the non-slip silicone dots on the bottom. So when patients do get up in the middle of the night, or if they get up in the middle of the night, they don't slip um, on any slippery surfaces. It is not padded on the plantar of the foot, so it makes it very nice. It gives them an easy, more balance when they're walking. Um, the upper extremity does have, it goes from axilla down to the MCPs. It has a retractable mitten, so which is really nice. The patients could just simply unfasten it to free their hand. So if they need to use the restroom or do a simple task, they could free their hand without any issues. Of course, there are contraindications to compression, and everyone knows this, but it's always good to review them. So, any patients with severe peripheral arterial disease, uncontrolled or severe heart failure, septic phlebitis, any acute infections, or erysipelas, these patients should absolutely not wear any sort of compression. But other relative, contraindications and precautions, of course, moderate peripheral arterial disease, diabetic neuropathy, reduced sensitivity, anyone with fragile or damaged or at-risk skin, we really need to closely monitor these patients. Any pain of unknown origin, intolerance to compression, of course, again, monitoring these patients. Allergies or hypersensitivities to any product materials, they should avoid them. And any other important clinical considerations. It's really important to make sure that you're monitoring these patients, especially if they do have skin sensitivities. Anyone has skin integrity issues or sensitive skin, it's a good idea to use a cotton layer or stockinette underneath the Mobiderm until patients can start seeing how it reacts with their system. But if someone develops any pain, numbness, color changes, or worsening symptoms, they should discontinue use. Tuan is here to support you in all of your medical professional needs. We have patient brochures, patient educational pieces. We have order forms. We have RX pads. We have PDEX letters and with our HCPCS codes. We can connect you with others who can help you and other national billers like Compression Care. I have to throw that one out there. We can also supply you with samples to have in your clinic so you can show your patients garment solutions that may work for them. So we are always here to partner with you and would love to hear from you. And this is our lymphology team that is here. So if you need anything, don't hesitate to reach out. And this is a QR code you can scan to take you to our catalog, although I just learned that it's not our most up-to-date catalog. So I did include the TheraFirm website. It's the wholesale.therafirm.com is the website that you can go to where you can see all the latest and greatest product catalogs. You can also request an in-service there, or I would be happy to set up an in-service with you as well.
Awesome. Yeah. So, I want to just invite everybody or anybody to put some questions in the chat if you do have any questions regarding the presentation or any questions regarding billing about the products, because I can answer most of them, I would think. But there are two links in the chat right now. One is to the lounge. That's where you can go and hang out with my team and just chat a little bit. I know I mentioned at the beginning too, but I'm reiterating. And then obviously the okay, we got some questions coming in now. But just so finish my thought here, the compression care big day of training resources page is linked on there as well. You can definitely hang out in there. Do you want me, Katie? Do you want me to send? Is it okay to put your information there into the chat?
Yes, and I actually just
Okay.
beat you to it, and I did that already. So
Oh,
my
okay, okay,
information is in the chat.
okay.
I
Okay.
guess I forgot the little part of including it on my last slide. It was on there, and I don't know
No.
what God only knows what happened
Hey,
to it today. So
that's absolutely okay. So one of the questions though from Sarah, is there a bra option in the works?
yes, so we do have our bra, and I guess I should have included it in this deck, although we were specifically talking about the auto fit. So we do have the bra. It came out in June of 2025. It's a wonderful bra. It comes with two removable small black pads. It is a true compression bra. It has 5 to 10 millimeters of mercury of compression. It has some nice wide straps. It's a long line, has a long line bra, so it has nice coverage and it doesn't curl up during the day. Um, Although it is a nighttime bra, we do have a lot of patients who are wearing it during the day because it is so comfortable to wear and it feels like a nice compressive bra. But it's also low profile, so it doesn't feel big and bulky or like a tactical gear. So they like that it is a little bit more feminine and discreet compared to other bras.
Awesome. So one thing, there's a comment that just came in from Samantha that says, "I just got the bra for myself, and as a breast cancer patient and provider, uh, it is the best." So we've got a lot of good things happening there. I mean, obviously it's being used, right? And so we're getting some good feedback there. Yolanda says, "Thank you. I appreciate you sharing your personal experience." Amber asks, have you seen or heard of any issues of durability? So, with the inner liner or anything? It's the inner liner. She says, well, she says it feels a little thin, but she wants to just hear if you've heard anything about the durability of the product.
I have not, but if there is an issue with the product, we do have a 6 month warranty. So if something is happening within 6 months, we will replace the garment. So if there is an
Yeah, I
issue,
think
please you
that
can
in
contact me. Um, but no, I like we don't hear the blocks. I mean, they're kind of stiff at the beginning, but they do soften up. But they maintain the use. We know that this is a 2 year garment, and so it maintains that quality for the 2 years.
Awesome. Yeah, that's awesome. One of the things that since you bring that up, the manufacturer they're good about doing replacements or returns when they need to be done, right? And it's their name on the line, so I could say that they're gonna stand behind that product. Also, just so we're touching on this, one thing that compression care is doing, like I know, and Katie, I appreciate that we say, hey, just reach out to me, we can get that started, but you can also, if you order it through us, you can reach out to us and we'll get that process started for you. In fact, one of the things, and for those of you who didn't get on the early morning when we talked about this, I mean, it might have been real early morning. It was 7 a.m. Central, so it could have been real early morning if you're West Coast. But we were talking about the return process through us, and you can email referrals at compression care and say, hey, something's wrong here, we need to get an exchange going, and we can start that process for you. But the other thing is, we're working on, in our portal, we're working to actually add a returns and exchanges button, so that you can just click on it, say what's going wrong, and then if it's a different measurement, something's wrong with the sizing, you can actually upload new measurements, show us what you need, and then just by that one click, we go out, get the RA for you, give you the instructions, and go ahead and place the new measurements if you put them in immediately. So instead of doing it step by step and each step taking a few days, you just say, here's what I want to do, and we'll have it all done for you. That button is not there yet, but my IT guys are working on that button. So hopefully, we'll see some new things coming out in the portal that will make that process easier on the therapist, and therefore easier on the patient too. So that's good. The Another question that came in: is there a way to get samples of the inventory so I can have some to show and my patients?
Absolutely. You can reach out to me and I can connect you with a local rep or one of the local sales directors for your territory. And we'd be happy to get you some
Perfect.
samples. Yes, I see that another question is the bra covered by Medicare? Yes, it is covered by Medicare as a nighttime garment.
Okay. What about the any recommendations for severe PAD patients?
So for severe PAD patients, I mean, we just really have to be careful and they need to ask their physician whether compression is appropriate for them. So I mean, an autofit is a nighttime garment. We know that nighttime garments don't provide a high level of compression because, right, we just want to maintain that reduction and that stability. So they don't have a high compression. So I don't think, and from my vascular experience, that it contraindicates PAD. However, our manufacturing and stuff, we still say that it needs to be done with caution. So we don't want anything tight on those patients. We know anything like over, I think 15 millimeters of mercury is like the highest that they should have on their legs. So we don't want to restrict any more flow.
Yeah, for sure. You do have to be careful with PAD for sure.
Hmm.
Uh,
Yeah.
one of the questions, and I've had this question come up on several different presentations throughout the day today, and
Hmm.
I'm so happy that we've made an impact and people from Canada are actually logging on here. How is the access to these products in Canada? How does that work with Tuan?
We have a distributor in, I believe, Ontario. And I think it's Sam Truman. I see the comment from them.
Yeah,
If you want to reach out to me, um, I'd be happy to figure out how we can get them. I know we're just looking for distributors in Canada and extending that network up there. And it is a work in progress. So I know we do have some, and I'd be happy to put you in touch with them.
and just so you all know, because we have been asked, and if you haven't been on Sam, I don't know if you've been on the previous meetings today, but I've been asked that a lot today. And one of the things I may be repeating myself to you, and if so, I apologize, but compression care, we are working towards having a distributorship in Canada because getting things across the border is impossible nowadays. It's what's
Mhm.
happened. It's just the era we live in right now. So we are working on that though. It'll probably start with our compression guru side, the self-pay side, and then hopefully we'll be able to move into the compression care side, moving up there. I would I'm excited about it. I think it'd be super fun if we can get that done. But good to know that we can get the products there. That's at least a start. That's a start, right? That's the first check. The next check is, can we get you the products there? So, and that would be the next part of that. So we are working towards that, and we definitely appreciate that. So that's awesome. I really do appreciate the questions, the comments, everything that's come in here. I want to say thank you for all of the therapists showing up, especially late in the day, especially if you started with us early this morning. Thank you for hanging in all day. We really do appreciate it. We've got a couple more presentations coming up to round out the day. And hopefully it's been super helpful to everybody. I appreciate you guys being here. And then, I'll also Katie, I really appreciate you taking your time to be here and to present, just taking the time to do this. Thank you so much for being here. We really do appreciate it. And if there's anything else y'all need, my email has definitely been on the screen for a while there. If you need me, uh, just shoot me an email. I do not mind. I will answer anything. Obviously, Katie's in the chat there too. Copy that out, and but I'll connect y'all. If you email me, I will connect you with Katie if you need to get connected with Katie. So, and don't worry about all those other links and everything. All of this information is on our website. You will get a thank you for attending email. You will get a video recording of this. It'll be on our YouTube channel. You will get all the information within the next few days. So thank you so much for being here. I really do appreciate it. And I hope you guys have a great rest of your day. Thanks so much. Thank you, Katie.
Thanks, everyone. Have a great one.
Bye bye.